In this video, we are going to talk about larva migrans, infections caused by the larvae or baby forms of worms that usually live in animals. We will focus on two main types, cutaneous larva migrans or CLM, which mainly affects the skin, and visceral larva migrans or VLM, which affects organs inside the body, such as the liver and lungs.
Let's look at the worms themselves. For cutaneous larva migrans, the infection usually comes from dog and cat hookworms, especially species called Ancylostoma brasiliensis and Ancylostoma caninum. These worms normally live in the intestines of dogs and cats. The adult worms lay eggs that pass out with the animal's stool. In warm, moist soil or sand, the eggs hatch into larvae, the baby worms. After a few days, the larvae become infective larvae that can penetrate human skin. For visceral larva migrans, the main parasites are roundworms from dogs and cats, especially Toxocera canis from dogs and Toxocera cati from cats. Adult worms live in the intestines of infected animals and produce eggs that are passed in feces. In the environment, these eggs develop into embryonated, infective eggs. Humans are called accidental or dead-end hosts for these parasites.
Now, where do these infections usually come from and who is at risk? Common sources and risk factors include contaminated soil or sand in places where dogs and cats defecate, such as playgrounds, sandboxes, parks, and beaches. Children who play on the ground. People who walk barefoot on contaminated soil or sand. People who sit or lie directly on contaminated sand, for example on beaches. For CLM, the classic story is someone who has been walking barefoot on a warm, sandy beach or in a sandbox where infected dogs or cats have passed stool. For VLM, a typical risk group is young children, especially those with pica or a habit of eating soil or putting dirty objects into their mouths, in areas where puppies or kittens frequently contaminate the environment.
Next, let's see what happens inside the body. This is called pathogenesis. Cutaneous larva migrans. In CLM, the infective larvae in the soil penetrate the top layer of the skin. They usually stay in the outer layers, especially the epidermis, and cannot go deep into the body. Visceral larva migrans. In VLM, a person swallows infective eggs. In the intestine, the eggs hatch into larvae. These larvae then penetrate the gut wall and enter the bloodstream. They can travel to various organs, especially the liver, lungs, and sometimes the eyes, brain, or other tissues.
Now, let's look at the symptoms. Typical features of CLM include intense itching in one area of skin, often on the feet, legs, buttocks, or areas that touched contaminated ground. A red, raised, winding, or snake-like line on the skin that may look like a track. The track may seem to move or lengthen over days as the larva moves. Sometimes there is swelling or small blisters along the track. For VLM, symptoms are usually more general and serious, especially in children. Cough, wheezing, or other breathing problems if the lungs are involved. There is also a related condition called ocular larva migrans, where larvae reach the eye, causing vision problems and sometimes a white spot at the back of the eye. This usually needs specialist eye care. How do doctors diagnose these conditions? For cutaneous larva migrans, diagnosis is often based on the typical appearance of the skin lesions and the history. In some cases, if the diagnosis is uncertain, a skin scraping or biopsy may be done, but this is not always necessary. For visceral larva migrans, doctors look at the overall picture: a child or adult with fever, cough, enlarged liver, and a history of exposure to puppies, kittens, or contaminated soil.
Now, let's talk about management and treatment for cutaneous larva migrans. The condition may eventually go away on its own, but this can take weeks or months and is very uncomfortable. Doctors often prescribe antiparasitic medicines such as albendazole or ivermectin to kill the larvae and speed up healing. For visceral larva migrans, doctors may prescribe such as albendazole or mebendazole to kill the larvae. In more severe cases, corticosteroids may be used to reduce inflammation.
The good news is that these risks can be reduced with simple measures, like regular deworming of pets, cleaning up pet feces, keeping play areas clean, and washing hands.